Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.
Hello friends, and welcome to Fairfield Today. I'm Paul Jasson. Thank you for joining us. We are again broadcasting and telecasting from the lobby downtown Fairfield Federal, where 125 years of banking is going on. The Quaska Centennial is well underway. You would know it perhaps by some of the things with what we're going through with the COVID stuff right now. So they're struggling with that as we all are. We'll talk about that probably a little bit later. But anyway, it's 125 years of banking right here at Fairfield Federal. So thank you for joining us. Second half of the show today, we'll talk about one of the really great agencies in town. When you think of all the nonprofit agencies in town, this is kind of the mothership of all those. They handle 22 of them. It's United Way. They just had their kickoff campaign. We'll talk about where that's headed and what we can expect from a very needed United Way campaign that's underway. First, we'll talk about another interesting situation here in the city of Lancaster. I think most of you probably know that the tax levy that didn't do so well the first time around is coming back here shortly in November, and it's a very important one for the city to maintain the services that we all know that the city provides and we all count on each and every day. And it's a pleasure to have on with us the Lancaster Fire Department Chief David Ward. Chief, thank you for joining us.
Thanks for having me, Paul.
Sure, thank you for having you. First of all, before we get underway here, where are we in day-to-day operations? Still busy as all get out?
You know, we had a slowed down during the COVID, probably March, April. The medic runs started going down, fire runs were going down. Yeah, I think people were afraid to actually call us because we were with COVID every day. Sure. I mean, literally every day with some of the nursing homes that have it and stuff. So we're out there, and I think people were really thinking of twice about calling us. But now we're back up to 30 plus run, 20 to 30 runs a day for just the medic. So we're throwing engines, we're looking at 30 to 40 runs a day.
I know when you talk about people that run into people possibly who could have the virus, well, you guys are on the front line of all that. Yeah. We had KJ Watts on a while back. Of course, he went through a terrible situation, and you guys in your department, you guys went down a little bit in terms of losing people.
We did. We got hit really hard like the third week of March, but since then, we've had guys who have gotten the antibody test, and we found out that a lot more have had that. So conservatively, at least 10 to 15 of us have had it.
Wow.
Yeah.
It's on a force your size, that's a lot.
It is a lot.
That's a lot.
Yes.
Okay. Well, we wanted to have you on today. We've had the mayor on, and we're going to have some more people on to talk about this because it's not that far away, less than 2 months now.
Yes.
The tax levy will come back, and this is a big one in terms of services that the city provides, so that when you make a call to somebody, there's somebody there to answer it and somebody's needed. And we're talking today with Chief Ward about really what this means to the Lancaster Fire Department. And even if this passes, you guys it's still a tight window for you guys. It's still tough out there each and every day, even if this does pass.
Oh, absolutely. It takes people to run the operation. To give you an example, in 2008, we were at 92 firefighters. We were able to fully staff our fire prevention program. We were able to handle our medic calls, our fire calls, our public relations, and secretarial staff. Then in 2011, through attrition from 08 to 11, we started to not replace positions. So
on purpose? On purpose,
okay. Because revenues were starting to come down, expenses were climbing. So we tried to cut expenses. So from 08 till 2011, we went down to about 83 firefighters. Then finally the recession caught up with municipalities. October 23rd, 2011, we laid off 13. So we went from 92 in 08 to 70 in 2011, and we thought that was about as low as we could go, right? However, and we held that for a while. Until about 2 or 3 years ago, when we started not replacing people who were leaving for better positions or retirements. So 70 was the recession level staffing. Today we sit at 63. So we've had several guys take out employment elsewhere. We've had some retirements, and we've not been able to replace. There's a hiring freeze going on in the city, so we're not replacing those. That drives up overtime costs. We just gave a test, and people, why are you giving a test if there's a hiring freeze? Well, it takes a long time to hire a firefighter. So there is a safety levy on, and to give you an example, when I was hired, we had 200 to 300 people take the test. A month ago, we gave the test. We had 10 people take it, 10, and 9 passed. And so of that, we do a very extensive vetting process. And typically, historically, if you have 10 people, you may only have 2 that you want to hire at the most.
Really?
So at those numbers, we can't even keep up through, if we were to be allowed to hire, keep up with just people retiring. It's getting very, it's a lot of work on the firefighters. There's no money. This levy, I can't endorse it one way or the other, but if it needs to pass. It really does.
It sounds like it's like 60s kind of numbers.
Absolutely.
If something bad would happen with this levy.
Well, when COVID hit, revenues went down. They told us to do a 10% reduction in our budget for this year. So I did that, and it was going to take us. It's all personnel now. There's no fluff in any of our line items. Last year I was short in fuel, and I was also short in medical supplies, and we tried to move from different areas to try and cover that. There's just no more fluff in non-salaried line items. 93% of the fire department budget is personnel. So when they said cut $1 million from your budget, that's people. And so they were looking at 21 positions, 3 or 4 through attrition, the rest were layoffs. And credit goes to Mayor Scheffler, Safety Director Martin, and Council for letting us hold on to see if maybe this CARES money comes through. And we haven't had to lay off yet. But it would have taken us down to 48 firefighters. You would have to go back to 1969 to see those kind of staffing numbers. And that's when we only did, Paul, maybe, off the top of my head, maybe 2,000 runs at the most.
And the number is now?
10,000. It's about 8,000 medic runs and almost 2,000 fire runs. Plus all the other things that we do now. We do underground storage tanks. We do fire inspections and things like that. So much work. So few people. We're busy all the time. This is a monumental thing for this levy. If it passes, we can do the services that the people really want and expect. If it doesn't pass, and I'm not a fear monger or anything of that nature, but it's losing people, losing services, and an engine house or 2 may have to go depending on the cuts. Now they haven't said if it doesn't pass, what will you do? This is the number. Obviously, if we go down to 47 or 48, we're going to try and keep 2 engines on the road and maybe 1 medic, which right now we have 2 engines and 2.5 medics. So it's a loss of services.
There's something I wanted to show right now. We've got a kind of a neat video here that Interphase Video has done for the Lancaster Fire Department, explaining what you've meant to certain people. Mm-hmm. Is that a decent setup for this? Yeah,
they did it for the safety committee, this levy program, but it's the people we've had hands-on contact with. One guy, 44 years old, massive heart attack. He knocks on the door of Engine House 2 one morning early. One of our medics was actually doing a medic report. Was the only, by the grace of God, did he hear it. Heard a thud, walked out. Here's this 6'4", physically specimen, had heart stopped. And with that quick intervention, we were able to, cardiovert him and defibrillate him, bring him back, and he's on the video.
All right. Let's step away and see that and just see what they have to say.
Okay.
When people want to move into Lancaster, they're looking at the neighborhoods. Where can they live? Is it safe? What are the schools like? And you have to have the availability of fire and rescue. Those are some essential things that you have to have, and people are looking for that when they move into the community. And right now, our community continues to grow. The population is just growing and growing. And all you have to do is drive around and look at all the housing developments that are going up and all the houses that are for sale here. People want to move into a smaller community. One of the reasons that I live here, I moved into the community in '91. As far as having the proper staffing here, to me, it's just essential.
Four years ago, I was pregnant, and at 32 weeks, went into labor early. And I think I was in a bit of denial that she was coming early, and wanted to get to St. Anne's Hospital where I could have maternal and NICU. And I didn't make it. So my sister-in-law called 911, and at that time we realized that the medic wasn't going to make it to where we were, and we weren't going to make it to the hospital. So there was a dispatch, and we were in contact with the fire department as we were driving and saying, okay, this is where we are, and this is where you guys are. And en route, our baby was born in the van, but right as she emerged, there was a team of medics that were right there. The doors were opened, and out she came, and it was comforting to have a group of people there that knew what they were doing. But there was one female there, her name was Ruth. And in the midst of all of these men who were doing the best they could in this labor and delivery in the middle of an intersection, Ruth was there as this calming voice. And I didn't have any fear, and it was beautiful. As crazy as it was, there was peace. So the timing was impeccable. She was born on High Street.
Well, it is what you said, pretty impressive.
Yes, it is.
Pretty impressive. I mean, this is what I guess most of us have no idea what goes on.
No. And, they say we touch about 7% of the population, ever. But when you need us, you need us. And we're an insurance policy, and no one likes to pay for an insurance policy because but when you need it, that's important. And if the levee should fail, there won't be as many of us to be there. And it's really it's important for the community. It's important for the safety of the public. I know police, I can't speak for Chief Pilar, but they're looking at the same kind of catastrophic cuts that we are.
Yeah.
And when you need us, you need us. And the community really supports us. So I'm hopeful.
Well, it'll be interesting. It's struggled a little bit the first time up. It was closer than perhaps what even some people thought, but it was close. And you don't need a lot to get over the hump now. You just need people to, if they have questions, I'm sure they can call you or the police department or the mayor's office over there, or Paul Martin, the service director, and everybody's more willing to come out and talk to anybody.
Yes. My phone number is 740-687-6640. I'm normally at the office by 7 in the morning and there till 4. Call me anytime, ask me questions. Chief Pilar's at his office. Also go to our website. We have our annual report, which lists every kind of data metric that you would want to look at. If you want to run response times or amount of Narcan we've given, any kind of number, fuel, how much we
Everything's
consume.
Out there.
Everything.
Open book.
Transparency.
All right, very good. Lancaster Fire Chief David Ward. Dave, thanks for being with us
Thank
today.
you, Paul.
And we'll get some people back on. We'll keep going with this till November.
All right, thank you.
Very good. Lancaster Fire Department Chief Dave Ward. We'll be back to talk to United Way in just a moment.
Fairfield Federal. When it comes to our customers and our community, we go above and beyond to help. Our people make the difference.
It's a hometown bank. It's located here in Fairfield County. Branches are convenient. They're located here in Pickerington, where my office is. I'm in Lancaster a lot, and they have plenty of branches there. And I much prefer dealing with the hometown banks rather than the larger nationwide chain banks.
So far, everybody's been so personable, and for us to bank with the local bank, and we bank in Lancaster, it's been so wonderful because we'll call somebody, Steve will call somebody, and they'll get back to us right away, or they'll say, okay, we're going to make a decision in the basement tomorrow, and they'll get back to us, rather than calling a bigger bank where we had to wait, and we didn't always get the same person the next time we called for a investment banking opportunity, or getting something appraised, any of those kind of things.
Everybody is very customer friendly. A lot of times I'll bring my dog Bear with me, and the staff love him here, and of course he loves them and the treats that he gets. So it's just a nice kind of a family type environment.
Personal or business banking, whatever you need, we take it seriously because we know you do. Stop by today at any of our 3 locations and see why the difference is clear. Fairfield Federal Savings and Loan specializes in banking that revolves around you.
Member FDIC, Equal Housing Lender.
All right, very good. Thank you for Chief Ward being with us today and talking about a very important moment in the life of this city as the income tax levy will be coming up in November. So we'll be talking about that more in the coming weeks as we head into that November voting time. Again, Chief was on, we've had the mayor on, we'll have Brad Hutchison, who's the campaign director now, is kind of heading things up. We'll get Brad on here in a couple of weeks and we'll talk more about that. Appreciate Chief Ward stopping with us today. Again, as we mentioned early in the interview and the show, the second part today is about United Way. And it was interesting, I was reading about United Way. They have a great website, a lot of good information. Their mission is listed as improving lives through the caring power of the community. Interesting, we'll talk about that. It's a pleasure to have with us, I think the first time on here, on our show anyway, Beth Craft. Beth is the Resource Development and Event Manager for United Way. Thank you for joining us.
Thank you for having me.
And your massive
really
staff. This is the first time we've had you on, so appreciate your joining us today.
Thank you.
You just had the kickoff for United Way. And let's give a little plug to our own Bob Campetti,
oh my goodness,
who is the guy this year that's heading up everything for an entire year. Got some big numbers out there, some big opportunities, an exciting time right now for United Way.
It sure is. Like you mentioned, we were able to do our kickoff last week. A little different this year than we've done in years past, but
everything's
that's okay.
A little different.
It is. We were able to be on Fairfield County Virtual Community, and so we were very excited to have that opportunity to do our kickoff. And yes, kudos to Bob as our campaign chair and his whole team at Interface Video for helping us this year. Actually, call it fate, call it what you will, but to have Bob as our chair this year is perfect because we're having to do so many things different and virtually. He's been hugely instrumental in helping us accomplish all of that, and we greatly, greatly appreciate it.
What is the dollar goal this year?
Well, I'll tell you, we're stepping a little bit away from calling it a goal, but what we're hoping to raise.
Okay.
And this year, what we're hoping to raise through our campaign is nearly $1.4 million. And that will allow us to continue to fund the 23 partner agencies that we have, as well as the 30 human service programs that we are able to offer through that funding. And that amount will allow us to continue at the level that we have been. Now we are taking into account, we've looked at things, we understand this year that things are going to be a little different, and so we've tried to take that into account, the pandemic and the effect that it's going to have on the economy and the community. So we feel that that's a number that we're going to strive for and hopefully reach.
As you headed down and kind of ended 2020, as you kick off the 2020-21 campaign, did the COVID virus have a large effect on everything from March till now for you folks?
Well, we actually, when this all started, we switched our gears just a little bit, and we partnered with the Fairfield County Foundation and created the COVID-19 Relief Fund, Fairfield County COVID-19 Relief Fund. And we were thrilled with the response that we got from that. We raised nearly $150,000 through that partnership, which was amazing. And to date, we have allocated out about $112,000 of that amount to nonprofit agencies in the community.
They've certainly struggled.
Exactly. And so we were very happy to be able to help them and to partner with, like I said, the foundation to do that, to accomplish that. And so now we're kind of switching gears a little bit and kind of bringing the focus back to our our traditional campaign or our annual campaign, because, quite honestly, the needs that were there before the pandemic, they're still here. And some of those needs are even greater than before.
Sure.
And so we want to, make sure that we are able to fund those agencies that are providing those great services that are so needed in our community.
Our guest is Beth Craft. Beth is the Resource Development and Events Manager for United Way, and we're talking about all things United Way. We have, in the course of a year, most, if not all, of the 22, 23 agencies. We have them on. Like, we'll have Maywood Mission, or we'll have the Lighthouse. We'll have all of them on at different times because they all have a great story to tell, and the job they do, especially in these last few years, it's been very difficult on nonprofits. And,
yes, it has.
And I noticed that several years ago, United Way did a turn, perhaps back when Sherry was still around, that they started, for lack of a better way to say it, holding these agencies' feet to the fire a little bit more. When an agency now gets money, it's just not turn in the dollar amount and you'll get that every year. Not that they don't need it, because we know they do, but you're very results oriented now, and I think people can feel comfortable that an agency getting money based on what you do and qualify them to get that money and watch them the entire year. I think the community can be sure that you are doing the best you can to make sure every agency needs the money and utilizes the money in a way that's right.
Exactly. They are, if you would call it, held accountable.
Yes.
But yes, they need to show impact. They need to show how the dollars that they are receiving are making a difference. And through the programs that we are helping fund, and we also, make sure that our agencies are aligning with our goals.
Yes.
Our goals of health, our goals of education, and our goals of financial stability. So we are, making sure that the agencies that we're funding and the dollars that they're receiving are working toward those goals. And so, as you said, people can feel comfortable and confident that when they donate to United Way, those dollars are going to these agencies and these programs that are working on those goals, those important goals.
Yeah, and not that it ever was a blank check and you guys just gave out money, because that never happened. But I think now this being held accountable, you've taken that to heart, and the agencies know that now. So when they turn a budget, they have to be able to say why they're turning that money in, what it's going to be used for, and you guys follow up on that.
Exactly.
Yeah, sure.
Yep.
We've got an interesting video we want to talk about now, something that was made for your campaign. Set this up for us.
Sure. Well, we are very happy to be able to show our 2020 United Way campaign video. Each year we try to do a video that just sort of tells people what United Way is, who we are, what we do, and there are times when we can share a story and show how people's dollars are truly making a difference in the life of someone in our community. And this year's video does an amazing job of doing just that.
I hear it's an exceptional video.
And we thank Bob and his team for putting this together. It's amazing.
This is the video we're going to show right now. So as Beth introduced it so perfectly, let's step away and see this campaign video for United Way.
What if you could change a person's path in life by simply working together with your friends, your neighbors, your coworkers, and community? If a child grows up in an unstable family, is unhealthy, and doesn't get a good education, chances are that he or she will struggle through life and likely rely on social services. If the home is stable, if the child is better educated, ready to work, and healthy, our kids will grow up more self-sufficient and able to contribute to the community in many positive ways. Education, financial stability, and health are the essential building blocks of a safe and stable life for both children and adults. For many individuals and families throughout Fairfield County, however, these fundamentals are out of reach. And that's where United Way of Fairfield County and the agencies they serve come in. A quality education, will help children and adults achieve success. Financial stability increases independence, and access to health care promotes wellness at all ages. The work that these nonprofits do all day and every day provides necessary and critical services to our community. And now, these services are more important than ever. Meet Mary, who made a life-changing decision by reaching out to the Lighthouse during her time of need.
I couldn't eat. I went to bed every night crying. Every night. You don't have to live in abuse. You don't have to give up, because there's always, always help. I called and they talked to me and they asked me what was going on, and then, you know, they told me they had a spot for me and my kids, and it was like a stack of bricks off of my shoulders, because I knew that it was going to be okay. Once I got in there, it was like, you're okay. No one is going to get to you. Nobody's going to hurt you. It is just going to happen. It was like you had someone to talk to 24/7 all the time. And everything that you could possibly imagine was right there. I mean, I was able to get a 3-bedroom home for me and my kids. And I remained working through all that. So I got to save, the money for me working, because when you're in there, they take care of you. You don't have to spend a dime. They do everything. They provide you with food, counselors. I mean, they help me out. They help me out with my car. And it was just amazing. I just love each and every one of them in there. They saved my life. They did. I have no doubt. I wouldn't be where I am today if it wasn't for them.
In this world filled with uncertainty, we are blessed to have a caring resource of people and programs right here in Fairfield County. A gift to the United Way is the shortest distance between your charitable investment and a stronger, safer, and healthier community.
I wanted to get my life straightened up. And I did. I'm there. I mean, I am more happy and stable than I think I've ever been in my whole life.
Well, you weren't kidding. That's a heck of a video. And that's just one story and literally thousands of stories out there. And I'm sure, if we had time, we just show more and talk about more. It's so needed out there, what you folks do.
It certainly is.
You guys, like I say, we talk to the agencies and they do all great work, but most of their money, if not almost all in some cases, comes from United Way. So you guys got a heck of a job ahead of you, and you do a great job down there, United Way.
Well, thank
we
you.
appreciate what you do. Any last comments on this?
Well, I would just thank you again for having me and for allowing us to talk a little bit about United Way. Be sure to go to our website.
Yeah.
There is a lot of really good information out there, and telling you about our mission and funding and how you can apply for funding, all kinds of good information. We're also on Facebook and Twitter and Instagram, so be sure you follow us and stay up to date on what we're doing in the community.
You're on places I don't even know how to get on. So I mean, but Beth Craft with United Way, it's again a heck of a story to tell. They do a great job. We'll be talking to them throughout the year, and we'll just see how this year goes. And again, if the indication from that story earlier is anything, it's needed. It's much needed, the goals and everything that you hit. So thanks, Beth, for being with us. We appreciate it. Thank you for joining us on Fairfield Today.
Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.